Hello, everyone. Thank you for joining our monthly Strengthening Families Networking webinar. We're going to get started right away here. Today we're doing a Strengthening Families Technical Assistance Clinic, which we've done a few times before. Try to get a couple of those in each year just to answer general questions and get some conversation going around Strengthening Families implementation. So I'm very glad that so many people were interested and submitted questions and have been able to join us. Here's a little overview of what we're going to do today. I will share some very brief updates from the Center for the Study of Social Policy. I'm Kaylin O'Connor. And Teresa Rafael will share some updates from the National Alliance of Children's Trust and Prevention Funds. We co-host these webinars, so we always start with these type of updates. And then we'll get right into our Technical Assistance Clinic, getting some questions and answers going from all of you with answers from myself and Teresa and Martha, who are all on the line, but also from you in the audience. So if you hear or see a question up on the screen that you've got some thoughts about, we encourage you to jump in on that. So let's get started with these general updates before we go into our Q&A, our extended Q&A. So this webinar we hold on the second Thursday of the month, each month. We've been doing this for many years. It's an open invitation to those who are using the Protective Factors Framework, and especially those who are coordinating Strengthening Families efforts. As I mentioned, we jointly convene these, myself at CSSP and our long-term partners, the National Alliance of Children's Trust and Prevention Funds. We pick a topic for each month based on what's new in the field, or where we're hearing a lot of questions, or where someone volunteers to share some information or convene a conversation. And we will let you know in advance what the topic is, so you always know whether it's going to be something of interest to you. You're always welcome to forward the invitation to someone who would be interested in a particular topic. And you're always welcome to suggest a topic if there's one that you'd like to share information about, or that you'd like to facilitate a conversation about with folks from other states. I can help you make those connections with the right people from other states, and we can get you on the schedule. So keep that in mind. And I'll also point out that Martha Reeder always posts the recordings on the materials from the webinars on a Google site, which is now this fantastic archive of Strengthening Families information. You can scroll through past webinars to see the topics, download slides, download the recording if you're interested. Sometimes we get the handouts up there with other relevant information. So I encourage you, if you miss one of these, to always check out that recording. But also, you know, if you've got some spare time, go through that list and find other relevant topics related to Strengthening Families implementation. There's a wealth of information there. I'll also point out that after the webinar, you'll get an email that includes that link and includes a link to the webinar right on GoToWebinar as well. So we try to get that information to you multiple ways, so you can always find it. So coming up on the second Thursday of the month coming up on September 14th, we will hear about balancing ACEs with HOPE. HOPE stands for Health Outcomes of Positive Experiences, and I'm very excited that we'll be able to bring this to you all. Dr. Bob Sagi is one of my colleagues at CSSP. He co-authored a paper recently by this title of Balancing ACEs with HOPE. And it's the beginning of sharing this emerging science about the positive experiences that we know children need, and how those promote positive outcomes themselves and also buffer some of the risks that children may face. So it's very connected to our Strengthening Families Protective Factors work. And I'm excited to have Bob join us on September 14th. On October 12th, we're going to focus on protective factors and kinship care. And then in November, we've got a webinar planned about essentials for childhood and how it connects with Strengthening Families. We may actually be bumping that a week because the regular date, the second Thursday of the month, would be November 9th, which conflicts with the Alliance's annual meeting. So we're checking with presenters, making sure we can make that change so that we won't have a conflict. And we will definitely let you know as we go forward, but just note that it's possible it'll be on the third Thursday that month. All right, I actually didn't have any further updates to share from CSSP, so I'm going to hand it over to my colleague Teresa Rafael from the National Alliance.
Thank you, Kaylin, and hello, everyone. I know we have a really rich discussion planned for today, So just a few updates related to some of the progress that we find very exciting at the Alliance around expanding the voices that are advocating for the work of strengthening families, supporting community initiatives, and doing work to help prevent child abuse and neglect. And you've heard a little bit about this. It's work we're doing in large part through Casey Family Programs, but in some other ways as well. And then at the Alliance, we have some of our own work going on. But it's elevating and promoting the voices of birth parents. And lately, we've been partnering with some other organizations to have combined voices of birth parents, kinship care providers, and youth. And the birth parents are all fully engaged and supportive of and speaking about the importance of helping all families build protective factors. And so it takes the work we're all doing in the Strengthening Families Network into different audiences with different perspectives and voices where it might be heard a little differently. But in May, we had a group of people on Capitol Hill making congressional visits. That evening, they were part of a dinner with a number of policymakers with table talk discussion about strengthening and supporting families and improving outcomes for children. And that went so well that earlier this week, a similar group, really about 35 or 40 birth parents, kinship care providers, and youth alums from foster care met with the Casey leadership team from around the country and spent good part of a day either presenting or in tabletop discussions. Couple of parents were recently at an American Academy of Pediatrics meeting in D.C. Talking about the opioid crisis and things to do about that, with the focus on strengthening and helping families get through it. And we've just had a number of other opportunities. I won't take the time to go into them, but that combined with the work of the Alliance's National Parent Partnership Council in putting together materials on the Strengthening Families framework and the protective factors has just been a very exciting thing to see, to add so many parent voices to this national conversation. And we will share more information as this evolves, but it really has taken off this year, and particularly this summer, after a lot of groundwork being put in place. And more will be revealed. We'll share more. Thanks a lot, Kaylin, and thank you everyone for listening.
Great, thank you, Teresa. You'll be hearing Teresa's voice as we get into the questions a bit later, too. One other quick update that's very well timed. Our colleagues in Idaho, Maureen Durning and Jane Zink, have some information to share about ways that they're trying to keep the conversation going about implementation. And so, Maureen, I saw your name here. I'm going to unmute you. And, oops, there, you should be unmuted. Can you speak?
Yes, can you hear me?
Yes, there you are.
Oh, good. I'm here.
So yeah, why don't you go ahead and tell folks about, tell folks about what you've launched. And I'll just remind folks, I think it was our May webinar that Maureen and her colleague Jane presented about their new book, Strong, with curriculum pieces that you can use to train on strengthening families and on protective factors. And so she's going to just share some of what they've been up to on social media lately. And then I'm sure they'll also have opinions about some of the questions that are going to come up. So Maureen, go ahead.
Okay, great. Thank you. Yes, we've joined the 21st century finally. And just recently we got on the Twitter and Facebook. Our Facebook page is called Strong Families, and our Twitter is called Strong Families. We were very happy that that title was actually available. I was surprised at that. In May, we did present our new training manual, which is about 55 lesson plans that are suitable for parents or for professionals who work with parents. One of the things that we love about the book is that in thinking about implementation, I've been hammering at this for the last several years, that implementation has to be personal, practical, and progressive. And one of the things that we heard from people that we had done trainings with or that we had worked with is that, oh, okay, well, we'll do this, we'll do the training, we'll learn all about it, but then what are the next steps? What are the next steps from knowing to doing? And so that's why we decided to create this book with many, many, many lesson plans in it. And we have menus in the back of the book so that, like one of the menus that I really like is a year-long training menu that you would do with your staff at staff meetings and things like that to keep that progressive idea in the forefront of your work. So I invite you to look at the website or join us on Twitter and Facebook. We're also going to do Instagram as soon as we figure that out. But the other thing that Jane and I are going to make sure that we do is coordinate our posts every month with whatever topic is happening here on the monthly call, so that we'll be able to hopefully, remind you what was going on the call, and also add further information to whatever the topic was. So yeah, thank you, Kaylin, for allowing us to show our brand new pages that have only been up for 3 days at this point.
Good timing.
We need some followers like us.
Right. And Maureen, one person, Michelle, wrote in a question. I'm asking, you said personal, practical, and what's your third P?
Progressive.
Progressive, that's what I thought.
Personal,
so it goes from
practical and progressive. It has to start with within, but it has to be practical, things that you can do on a daily basis. But it has to be progressive. It can't just start now and then stop. It has to be part of the culture of your agency.
Excellent. Thank you, Maureen. And I hope people will join there. I'll be keeping an eye on those conversations. Love to see when people have questions to ask and others are able to share their experience to help people figure out their next steps. So thank you. All
You're
right,
welcome.
so we're going to get into today's agenda, our technical assistance clinic. Some of you may have participated in one of these before, so bear with me while I explain a little bit about how it works. This is your opportunity to get questions answered, learn from each other, share experiences, and identify opportunities to collaborate. So we have a number of questions that were submitted in advance. I think there's about 12 of those. You can also type in questions as we go. And we'll try to get to as many of those as we can. Lola just typed in that she just liked your Facebook page, Maureen, so you're going to see more likes coming on as we go. That's exciting.
Hooray!
All right, so for the logistics of how we do this, if you want to submit a question or if you'd like to share your response to someone else's question, you can type in the questions box, or you can raise your hand if you'd like to be unmuted to speak. So there is this place you can click on the little hand, whatever it looks like on your screen. And if you raise that, Trish and Teresa and Martha and I will be able to see that you raised your hand, and we can unmute you then. And hopefully then if you're in a space where you can speak without background noise, go ahead and do that. It's nice to get actual conversation going. Otherwise, go ahead and type, and we will try to respond in a way that others can also learn from what's being typed in. So those are our logistics. And I put pictures of myself and Teresa up here. I wasn't sure that Martha was going to be able to join us, or I would have had her photo there too. But we're all here to answer your questions, myself, Teresa, and Martha Reeder, and then all of you, because you've got the expertise in this in your own communities and organizations, and we want to hear your thoughts as well. So without further ado, let's get into it here. Our first question is from Lola Cornish at the California CCR&R network, asking about how QRIS systems and child care resource and referral agencies are implementing strengthening families. I'm going to start off with a couple responses to that. and hope that others will also jump in. And Lola, I saw that you're on the line, so if you want to, jump in with follow-up questions as well, that would be great. So on the QRIS side, that's probably one I can answer a little more systematically. We did an issue brief about this, probably 2.5 or 3 years ago. So some of it may not be the most up-to-date, but I still think it captures the different ways that QRIS systems have been implementing strengthening families and building it in. So I'm actually going to jump to our website and show you where you can find that. Under Systems, on the Strengthening Families website, you can go down to Implementation in Early Care and Education Systems. And there we've got state approaches to integrating strengthening families into quality rating and improvement. So I encourage you to check that out. At a high level, I'll say some of the ways that it's being implemented are just with training. So you can get, for example, in some systems, there's 1 point in the STAR rating system where an early care and education provider can get an extra point towards their rating if they complete something related to family engagement, which would include strengthening families training, or it might be prescribed that it has to be strengthening families training. That's a pretty light touch way to do it. But I know in Wisconsin, for example, when that was introduced, when the quality rating and improvement system was first unveiled, the phones were ringing off the hook for who provides this training, how do we get it? Because for some providers, it was the first they heard of it. So it's a good way to raise awareness of it, if nothing else, to get people into that training. And perhaps there's a requirement for what percentage of staff have attended that training, something like that. Then we get into more of actual practice change. A few states require that providers complete the self-assessment of their practice for strengthening families and submit an action plan for some areas where they want to improve their practice around strengthening families. That I would say is much more hands-on, really trying to get at, you can't just learn this information, you have to show us how you're going to implement some changes with it. And those are the primary ways. I wonder if anyone wants to jump in with other pieces on the QRIS side of this question.
Kaylin, this is Martha. There are some sort of not as obvious ways that strengthening families becomes a part of QRIS. And one of those is there are many standards that are part of QRIS that other than strengthening families, things like the environment rating scales. I think that a lot of times providers look at those as a checklist and checking things off. Many times the items on those scales are very strength-based and really correlate very much with the items on the strengthening families self-assessment and with all the everyday actions and things that help to strengthen families. And so in the being aware of those things and how they cross over and how they support each other, the strengthening families is the why, and the environment rating scales are kind of the what. So having someone that is able to make that connection, and sometimes that's where the R&R folks come in with the training that they provide. So when they have the background that they need in protective factors, then they're able to make those connections and point those things out, that it's not just a checklist, that when you do those things, you're strengthening families.
That's a really good point, Martha. A lot of the concepts might be captured in other elements of the QRIS, even if it's not called strengthening families. And I like your segue there to the, oh, go ahead.
Well, I was just going to point it out. I'm not sure that we have it up on our website anymore, but in the early days of strengthening families, we had the folks in Tennessee actually did a crosswalk between the self-assessment and the environment, right? The Eckers and the Itters. And so there is some information there to support that. And, you know, it wouldn't take much for a person that was familiar with both instruments to be able to sort of see how related they are.
Mm-hmm. It's a really good point. I'm going to jump to the CCR&R part of this, the question about how child care resource and referral agencies are implementing Strengthening Families. And so a large part of it has been from the very beginning of Strengthening Families that CCR&R have been critical in providing the training for centers and home-based providers to start implementing these changes. And they've done that, you know, just straight up through training or through convening learning communities of providers that want to work together on making some changes. There are a lot of different ways that R&Rs can do that for supporting the providers in their community. The other piece that I would say we haven't dug in as much on, but would love to, is about how resource and referral agencies are using the protective factors in their own practice. So, for example, on the referral side, organizing what services are available in the community and thinking about which of those serve each protective factor or support families to build each protective factor, or making those kind of lists available to child care providers so that they can do a better job of making those connections to concrete support in times of need. And we actually, at one point, we were starting to work on something to really examine how CCR&Rs were using protective factors in their own practice. And I'm not sure we got as far as we hoped for that. Lola did type in California is doing what you're describing. So those are some of the ways that the California Resource and Referral Network is using Strengthening Families. And she says Strengthening Families is central to new training coming out for referral counselors. Oh, that's great. And then I think also, you know, those referral counselors are the front line that many families are engaging with. And so if they're using a strengths-based approach, that's going to improve the family experience and help them be more receptive to whatever services and supports they do need. Anyone have other thoughts you want to share about QRIS or CCR&R connections with Strengthening Families?
Kaylin, this is Maureen again.
Yeah, go ahead.
I think this really speaks to the importance that the protective factor framework isn't just for the clients or for the people we're working with. It's with the clients, but it's also within the organization and across systems. So that if everyone is speaking the protective factor framework, and it starts with having those CCR&R folks thoroughly trained in Strengthening Families, you know, they have to know what they're doing and why it's important. And I think that's one of the things. I wish Jane was on the call because she's our QRIS director here in Idaho, and she knows a lot more than I do about how they have incorporated it. But it really does go back to ongoing training with all of the staff as well as with folks who are working directly with parents.
Yes, very good point. Thank you. Okay, I think we'll move to our next question, which is what are some ideas to help our rural communities in our state? And this is coming from Janelle Cole in New Mexico, the Family Development Program. And I'm curious to hear what thoughts people have. I'm going to share a couple of resources. One would be, and I need to be indexed better. We had a recent webinar where our partners from Alaska talked about the strategies that they've used to reach rural Alaskan communities, which if you want to talk rural, that's about as rural as it gets within the U.S. But I think really some of those ideas really apply in terms of how they were able to just make these connections with rural communities that were different from how they were working in the cities and even the towns. So I may, while someone else is talking, find which webinar that was and try to pull up a link to it. But I also wanted to show, again, back to our website. I have too many windows open here, but we put out a paper, CSSP did, a couple of years ago, which is actually not within our Strengthening Families work directly, but it's within our Young Children and Their Families work, which is where Strengthening Families is as well organizationally. But we did a paper about strengthening supports for young parents and their children, which from that title you wouldn't know, but it is focused on rural and suburban pockets of poverty, and how we support particularly young children. What I would really point out here is a scan of innovations. So within this paper, we share examples from, I think, 6 different communities of innovative ways that they've been working to support young families in rural areas. So I'd encourage you to look at that. We've got Climb Wyoming. I'm not trying to make anyone dizzy. We talked about the Fostering Hope Initiative in Oregon, and Discover Together, which is in Tennessee. So a few different examples from around the country of rural areas, and not necessarily strengthening families approaches, but approaches that are trying to reach those families. And in many cases, they're also using a protective factors approach and finding good success with helping those families. So I'd point you to that resource. And then I want to hear what others might have to say about supporting rural families.
Kaylin, this is Martha again. I would say that some of the strategies that work in urban areas are still also work in rural areas because of their flexibility and their ability to be molded and shaped according to the needs of a particular community. Things like community cafes, and in Arkansas, there is a very wide use in our rural areas of the Caring Conversations cafes, which have the protective factors embedded throughout them as well. So that's just, if the strategy is malleable and adaptable to a community, then I think it could work both in an urban and a rural setting.
Thanks, Martha. Yeah, I think some of the same things we think about when we're applying something in an urban setting are equally important, but you have to tackle them differently in a rural setting. So we talk about the importance of transportation. Within an urban setting, that might mean giving somebody, giving people a bus card, or driving around finding them. In a rural setting, the distances can be much longer, and it's just a different consideration of how are we going to make sure people can get where we want them to be for a cafe or for our programs, or sometimes how are we going to get them where they need to be for making money and getting their kids to childcare and all of that. And so transportation is an issue everywhere, but in the rural areas, the challenge is a little bit different. But I agree with Martha's point that a lot of the strategies work the same. It's just figuring out how to get people where they need to be and how to reach them. One of the things we point out in that paper that I shared was that one of the benefits of a rural community is often that everyone knows each other. And that's a blanket statement. It's not fully true, but certainly among service providers in rural communities, the services may be further apart, and there's less density to what's available, but the density of connections between the service providers can be really strong, and often is really strong. And so there's more of it's easier to make those referrals. Like we talk in urban settings, we want people to make the warm handoff kind of referral. That can be challenging because they don't know who works at the Family Resource Center in the next neighborhood over, or at a different type of service provider, even within their own neighborhood. But usually in the rural areas, people are much more connected and able to help people find what they need from what's available because they know each other better. Anybody else want to share thoughts about how to help the rural communities? I see someone has typed in. So Lola typed in, and I'm going to, this is a little goofy, I'm just going to write thanks and send to all so that everyone can even see what you typed in, even though I'm not typing much of an answer. But I'll read it out loud. Lola says, social isolation can be a huge challenge in rural communities. Taking advantage of existing events to promote protective factors might be a good tactic. I think that's a good idea. I also think, you know, looking at things like where do people go to get their groceries, or what's the gas station that everyone stops at, like where can you put up flyers, or you know, make sure that people are aware of what's going on by going to those hubs that they're already at. Okay, any other thoughts before we move on? I did see a question from Dawn Garundo typed in, can we get a link to connect with peers from this presentation? I think we will have a link for the recording and the slides. I think for connecting with each other, I'm not sure how to facilitate that aside from going to like the Facebook pages. We have a Strengthening Families National Network group that you can join. We also have what Maureen just shared with the butterfly trainings that transform place where people can connect. The Alliance has social media options as well where you might connect in. So there are ways to connect with peers, or, you know, if there's someone who mentioned something that you want to know about, you can email me. I can connect you to them. And you should have my email address with the reminders from this webinar. I see Teresa shared a link in the chat box if anyone wants to check that out, the publication with parent voices about what constitutes quality childcare. That was connected to the development of Washington State's QRIS system, and really helped to, it was a way of infusing the protective factors approach into how the QRIS was designed, as well as then what was included in it. So that's a great link, Teresa. Thanks for sharing that. Okay, we'll go to our next question. None of these conversations are ever over, really. So if you wanted to still chime in on an earlier question, don't hold back. Okay, so our next question is from Blythe Butler in Canada. I'm sorry, I have to close the questions box so I can read it. So Blythe is from the First 2000 Days Network in Alberta, and she asked, does anyone have lessons they can share on using a quality improvement approach to implementing strengthening families? I want to hear what folks have to say about that. And I'm trying to check right now whether Blythe is on the call. I don't see her name yet, but I know she'll listen to the recording if she's not able to be on right now. Does anyone have thoughts you want to share about a quality improvement approach to implementation? One thing that, oh, go ahead.
Oh, Kaylin, it's Teresa. I was just going to say that in so much of the work that we do around publications or strategic planning or any area, we do tend to vet it with multiple audiences, sometimes together, but often in different ways, with our board, with our members who are working to implement strengthening families, and with the families that we work with we always want to make sure everything is clear from a parent perspective, as well as the trust funds and our other peers and colleagues around the country. And I just can't recommend it enough. And one of the things you have to do is slow down the process a little bit to allow time for that input. And we use SurveyMonkey. We do it in writing. We have sometimes webinars or even focus groups by conference call. We provide lots of different ways for groups to have input, because people, work best and think best in various ways. And it just has enriched our work in so many ways, and I can't recommend it enough. But it is using those ways to allow lots of input, structuring questions, and then collecting the data and using it to help change the work over time. So that's a very kind of general response, but wanted to throw that out there.
Thanks, Teresa. Yeah, I agree. I think that's a really important piece. One thing I was thinking of with the quality improvement approach is, and this might not be news to Blythe because I think it's a lot of what they're doing in Alberta, but I think the self-assessment can lend itself to a continuous quality improvement kind of approach, so that like we know where groups get together and do the self-assessment about their own programs, or if they've done the self-assessment with a team at their program, then one person is bringing that consensus self-assessment to a sort of learning community group. And then you can target which areas you rated yourself low and you want to improve. And then you can go back and assess whether you did that and sort of, you know, identify a handful of things you want to work on in the next 6 months and then check in on how well you did them. That sort of iterative process of then saying, okay, what are we going to do next because we accomplished these things. I would characterize that as a quality improvement approach, even though it's not extremely systematic, but I think there's a way to do that that sort of says we're consistently assessing how well we're doing and checking back in on it and making the improvements that we identify are, you know, important and within reach right now. I'm not sure if anyone else has quality improvement experience to share or thoughts about that.
This is Maureen. I don't know if this exactly fits, but I feel like it could fit into this. One of the things that we worked with a local agency here they were doing wonderful work and they knew it, but it wasn't in the protective factor language. So we helped them to change their paperwork so that what they were doing fit into the protective factor language, and then they could actually could count up. I mean, they actually made a numerical assessment of their reports. So the approach that we called it in notice, name, explain. So if a family, if an agency employee was working with a family and they noticed something, you know, suppose they said, oh, the mom has gone to AA meetings for the last 3 weeks. So that's what they noticed. But when you name it, you know, you could name that as being that's helping her resilience, it's helping her concrete support in times of need, it's helping her social connection. And so then they could explain in their report then how going to the AA meeting was building those protective factors and what the value of those protective factors were. So I don't know if it exactly fits, but it really helped this agency, and we've been starting to use this notice, name, explain as one of the options when we do consulting and when we do our train the trainer events. If people want to take it a step further into implementation, that this is a way that you can change the way you write your reports so that you actually have a handle on what's on what protective factors are being built and which ones maybe aren't.
I like that example. Thank you, Maureen. Oh, okay, I jumped ahead. Looks like I advanced the slide before I completely meant to, but I think we may have gotten all the answers we've got for that question, so I think we can move on. Someone asked, what is the relationship between the standards of quality, and this is another question from Lola, I should say, the standards of quality from the National Family Support Network and the Strengthening Family Self-Assessments. So they are connected. And we actually, another paper, I can jump to our website again, if that's not making people busy, and show you where we had last year, gosh, I'm losing track of time. It might even be 2 years ago that we released this. The National Family Support Network and CSSP and the Friends Resource Center for Community-Based Child Abuse Prevention got together and wrote a paper and actually put together some materials about how all of these things are connected, the different self-assessments that are available, because we knew it was a bit confusing to the field. So on our website under systems and under child abuse and neglect prevention systems, you can see our choosing a program self-assessment tool for Family Strengthening and Support Program, where we talk about how these are all related and give some scenarios of situations where you might choose to use one type of assessment or another. But at the high level, I'll summarize it that the Strengthening Family Self-Assessment, particularly the one for community-based programs, which would be the one that like a family resource center or parenting education type of program would use, that gets at what you can be doing in different ways throughout your practice, focused on helping parents build protective factors. The standards of quality from the National Family Support Network are about many more aspects of operating a program like that, of any type of program that has part of its mission is to strengthen families or support families. So it gets into more things about staffing and what other elements of quality practice, whereas our self-assessment is really focused on sort of, I would say we almost assume that you have those other things in place and you're trying to improve your specific family strengthening practices, whereas the NFSN standards of quality really get to all of these operational aspects, how you're connecting with the rest of the community, how you're evaluating your progress and your effectiveness, and how you're building protective factors. So they are complementary. The standards of quality were informed by the Strengthening Families framework, of course, as well as by the principles of family support practice. And I can envision a lot of scenarios where a program might use one and then use the other a year later, or might use one and put the other on the back burner, or, there's a lot of different ways you could do it. In that paper is also the Friends tools that were, some people may have been familiar with when Friends had a peer review set of tools. These are the tools that were designed for peer review, updated and modified for use as self-assessment. And so those are also available, and they get into very specific aspects of program practice. So there's one just about father involvement, for example, where that's a piece of our self-assessment and it's a piece of the standards of quality. But you can do a whole shorter assessment just about father involvement if you really want to focus in on that as one example. So these are all tools that are available and useful, and the wonderful thing is they're all available to use for free with different trainings that will help you use them better. And I think it just really depends on the situation and what you're looking to get out of it, which one you would use. Does anyone else want to weigh in on that question? Okay. This time always goes faster than I think it will, so I'm going to keep us moving. Taryn Yates from the Idaho Children's Trust Fund asks, what does Strengthening Families implementation look like in an organizational setting? And I think we touched on this a little bit when we were talking about how child care resource and referral agencies might use it. But I think there's a lot to be gained from a protective factors approach in an organization as opposed to just in a direct service type of program. But I'm curious what anyone else might want to add to that. And Taryn, I see that you're on the line. I can unmute you if you'd like to say anything more about your question, but I don't want to unmute you against your will if you're not in a good place to talk. Okay, she typed something in. All right, Taryn says sure. Okay, so here we go. You're unmuted, Taryn.
Hi. Yeah, I was actually we've been working with different organizations, and I noticed, there's quite a bit out there for early childhood education, but, we've started working with, like juvenile justice organizations and different organizations like that. So I just wanted to see if anyone had done that sort of thing, and if there was any tools that they had developed for just kind of walking through, or something generic enough that you could work with an organization working with any kind of population and kind of go through these steps on this is what implementation could look like.
Mm-hmm. So one thing I'll say. This is Maureen. Oh, go ahead, Maureen.
Oh, okay. Taryn, I know you know this because I think you gave them the grant, but Jane and I did do a train the trainer with the St. Anthony with the Juvenile Detention Center. And one of the things that we did as far as our book Strong, we have 8 chapters in there. The 7th chapter is on Youth Thrive, and we discuss in there how to adapt the lesson plans in the rest of the book if you're working with either youth directly or with families, parents of youth. And we have a lot of extra resources in there. So, you know, we felt like that was really important when working with youth. And other than that, in an organizational setting, I just think it's important. It's got to be at the forefront of everything. I mean, you can have strengthening families in your staff evaluations too. You can have strengthening families as the start of every meeting you have. You know, it's got to be pervasive.
This is Teresa, and I agree completely that the whole framework has to be woven into every element of the conversation, and including hiring, staff evaluations, and that includes engaging multiple audiences in some of those hiring decisions, and you know, who you have and their willingness to embrace this work is critical, and then woven into your budget. You know, do you budget time for training and support work? Do you budget times to make opportunities for parents to be engaged and have their voices heard? What we have seen is with the online training that the Alliance has, and, you know, it's free of charge for anyone, that sometimes organizations will use that as kind of a jumping off point, and they'll have leadership that says, we want our whole organization to be infused with this thinking and this work. And so they will, just last week I heard from someone wanting to know how long each module would take, because they wanted to plan staff meetings so they would do the modules together, and then they would have discussion about how all of that applied to their work. And there's no reason that couldn't happen in collaborative settings too. So individual organizations can do that using the online training or any other training. It's probably the conversation that is the most important piece, and a common base of knowledge and a common language. And then the more that's highlighted as we do our work, you know, the more embedded it will be. But from the boards, if they're nonprofits, or at very high levels, if it's public agency, to have support for that work is probably one of the only ways to really make it happen in a lasting way.
Those are all great answers. The one other thing I would add, Taryn, I don't know if you've looked at our tools for child welfare practice, which may be relevant for other audiences as well. I've heard about people using them in other settings. I'm just going to show again on our website. I'm doing this partly because I know people find our website a bit overwhelming at times. So I'm still on the Strengthening Families in Systems, and you can look at implementation and child welfare systems. And we have these practice tools for child welfare, which I think can be applied in a lot of different ways. And some of it that might be most useful is, for example, these practice reflection tools and the coaching guide for supervisors. I think we wrote these thinking of child welfare caseworkers and thinking of both Strengthening Families and Youth Thrive together. But I think they can be really useful in other systems too, where the supervisor can look at this tool to say, for each, there's some sort of general coaching activities for how you can talk with your worker about whether, you know, how they're doing at identifying strengths and building on them, how you can support protective and promotive factors as part of a case plan. And I think in other systems this also applies. This coaching tool also then goes through each protective factor and has the things that a worker should consistently be able to do, what a worker should be able to describe, how case plans are structured, and then some indicators that extra support might be needed and some coaching activities. So we have that for each of the protective factors. I think it's probably worth looking at that for whether it would be useful for the other systems and organizations that you're working with. And the other piece that I would share here, that I know I've heard people talk about adapting for other systems, is the practice reflection tools. So for the child welfare system, we don't have a self-assessment because there are so many other assessments that those systems need to use and complete. But we did do this as something that a worker could use for themselves to rate how consistently they take certain types of actions, and then could talk through with a supervisor. So it's, and it goes through the different ways in which you engage with families. So the engaging families as sort of intake level, then we go through assessment. What are we doing when we have to assess parents or youth? How are we using a protective and promotive factors approach in services and supports planning? So as you can see, we have these types of steps you would be taking and just rating your consistency of use. And I think in a lot of different types of systems, this is the sort of process that a case needs to go through, and so you can apply these thoughts. Feel free, anyone, to reach out to me if you wanted to adapt this for a different system and you'd like the Word versions of it so you can work right in it, or if you'd like to talk through it with me, I'd be happy to do that. And I think that some of those tools might be useful for the types of applications you're thinking of, Taryn.
Okay, great. That's actually, yeah, I would love the Word version of that. I mean, that's definitely, because I know, as Maureen said, I'm completely bought in on needing this to just be part of everything from the very beginning conversation to, the staff meetings and intake forms and everything. But, it's just getting the, it's knowing that, and then it's the step between knowing that and doing that, So I like, exactly. I like these forms. Thanks. Yeah, I definitely think I could find these useful.
Okay, great. You're welcome. Lola said she would also love the Word version so she can adapt for R&Rs. So I will be sending those out to a couple different people. Remind me if you don't get it today or tomorrow. And we'll see what you can do with them for different settings. We love to make, have people make the best use possible of the tools that we have developed. Okay, now we have a question from Clarence Little at Grove Hall Child Development Center in Massachusetts. He asked, what is best practice as it relates to expanding community involvement on the part of the families and center? And so I read this question to say not just what are we doing within the walls of our early care and education center, but how do we get the community engaged and engage the families more and just have more flow between the communities, the families, and the center. So does anyone want to share some thoughts about that? I don't want to be the one talking all the time. I will talk if no one else is going to.
I wondered if Martha is still available and might say a little bit about some of the Parent Partnership Council tools, because it seems like those might have use here and they have some directions.
Well, we have a lot of input from the parents on our council. In fact, they have a lot of experience from work in their own states, and they bring that to the table as we are working and developing new tools and ideas. So I think that the first thing we always think of is ask parents, ask what's important to them. Find out what is, what's really happening in the community, and what people's priorities are with regard to their community and their family, and so we do that. We in the Alliance National Parent Partnership Council, anytime we're working on a tool or creating a resource, we go directly to each of their own networks of parents, and we also distribute things to the trust funds across the country so they can share surveys and questions with parents in their own networks across the country. So we're very interested in hearing what people really think, what they are saying, and how they are reacting to even, whether there's a need for whatever it is that we're trying to develop. So I think that basically going to the source and basing your work on what is a priority with families and communities.
Thank you. That's fantastic. I'm going to keep us moving. Oh, go ahead.
This is Maureen again. I'll just real quick. We always say in strengthening families, it's all about relationships, but it really is all about relationships. And when you talk about expanding community involvement, a lot of it just means going and meeting people and asking them. Some of the very best child care facilities we have here in Boise, they go to the neighboring stores and they say, could you give us a donation? Could you volunteer your space for us to do this, that, or the other? Could you, and the same thing with the families, so it's just, I think, getting yourself out there and talking with people and making connections with people in the community so that they know who you are and they get invested in the excitement of what you're doing for children and families.
Great points, Maureen. Thank you. I'm going to give a really concrete example. We don't have time to get probably to another question, so I'm going to just share this example that I always love. That came from years ago as we were studying exemplary programs for early care and education centers that were already doing a lot to strengthen families, and that informed the whole development of the self-assessment. But one of the centers that was profiled there was a really small center in a small town. So this actually gets a little bit to the rural question too, in Leelanau, Michigan, up in the northern part of Michigan. Where they had a family pizza night at the laundromat. So this was engaging businesses in the community to support the families that were part of this child care center. Actually, I think it was probably for any families in the community. But the idea was that one night a month, families could do laundry for free. Childcare was provided to do some entertaining activity with the kids while the parents got some parenting education content during that evening time, and a local pizzeria next door to the laundromat provided pizza. So you meet a whole bunch of protective factors right there, some concrete supports, some knowledge of parenting and child development, hopefully some social connections along the way. For the businesses, they're building social capital, right? They're providing a service to the community. People need to do laundry more than once a week or more than once a month. People, want to go out to pizza, and they'll probably patronize the business that has been supportive of them with some free services when they do need to go out and pay for it. And it just generally strengthened that whole community as a way to bring people together. And the child care center spearheaded that, but I think was for anyone in the community. So I love that example. I think it's not overwhelming to say like, well, yeah, we could find a laundromat that wants to do that with us, or whatever other community setting might want to do that, where you can help families meet a concrete need while also building some of the other protective factors and building political or good public will and getting people engaged. So I think with that example, we will probably wrap up for the day. I'm sorry that we didn't get to all the questions, but I think we may do another one of these soon. And I'll also encourage you to jump on one of our social media forums that were mentioned earlier, or send an email to a group and get some conversations going, answer your questions. I do see, before we close off, I'm going to read a comment from Rebecca Mather in Wisconsin. She said one of our protective factors presenting groups actually did something similar to the Michigan example. They were able to get a local Italian restaurant to sponsor them, allow them to meet in the restaurant and provide a meal. The school was across the street, so they became involved as well. So I think that's a great example. And like Maureen said, if you don't go out and ask, those local businesses will probably not even know that they could be involved. But if you go ask, they may be willing to provide space and food and services that can benefit everybody involved. So thanks for sharing that, Becky. And thanks everyone who's chimed in and who sent in questions in advance. Really appreciate this conversation that always reminds us of the depth of Strengthening Families implementation going on around the country, which is always great to hear. And I look forward to talking to you all again in September. Enjoy the rest of your August and take care. Thanks, everybody.
Thanks, everyone. Bye.